I'm Dr. Annie Stanley Thakur. I'm the Group CEO for Pranaam Hospitals. Pranaam Hospitals is a multi-speciality, super speciality hospital with a 22 years of legacy. We have all the specialities within the system. And along with Pranaam Hospitals and GemCube, we have come out with something to give back to the society, that is Anytime Clinic. Because we know that during the corona time, it was really, even to the villages, reaching out the people were a very difficult task. And even the nation's call is like one nation, one health. So when it comes to such a big significant impact and innovations of the nation and the world, we thought that we will do something back to the society with some innovation. That is how this Anytime Clinic, which has come out with the ideology of Dr. Manish Gore. He is our managing director of Pranaam Hospitals. Very passionate clinician. Being a pediatrician, he really wish something he could do and give back to the society, because that is what he always think for the world. So with that, and when GemCube CEO Vinod has come and we're discussing, we thought, why don't we come up with something which can be give back to the society? That is how the Anytime Clinic has come. And this clinic will enable everybody to have a medical assistance 24/7. And we could say like this is a primary healthcare, and where the basic investigations, for example, diabetes, hypertension, anemia, which can be taken care, with a good lifestyle, with a good, advice. And then this clinic can be connected to various hospitals within that vicinity, and they could also be a part of, service provider for the betterment of the society. So we do have many questionnaires in the system which will help you to have the risk assessment, including cancer risk, HIV risk, and everything. And even there is an IQ. You can have a intelligent test how good we are with our IQ and logic, solutions for the problems. And then we can do HB. Hemoglobin level, so you know that is anemic, then accordingly you can change your lifestyle. And there is all vitals, including a pulse oximeter, so you can check the saturation, so you know that sometimes how to cope up with the crisis. And if you have an chest pain, then we can also take ECG there. And also cholesterol check. It's like a ATM, here HbA1c, all the card things, whatever we can have with a card, every check is being installed in the system. So it's like a health ATM where you can go, you can clear your doubts, and you get the reports instantly, because all the equipments which is used are approved equipments with proper calibration. So I think this is a help to the society to ensure, and especially when the kids are not there, they cannot travel a long distance, and there is no transportation, nobody to carry them. These all units will definitely help them to take care of their health. I think this is going to make a great revolution, and we don't say like it is like something which will be creating something different, but it will definitely help the lifestyle better. And the charges will be very nominal, because considering all levels of the population, if it's a middle class, the poorest one, or everybody can avail this in a very easy manner. That is what the entire concept behind this Anytime Clinic. Thank you.
When this is gonna be launched and when it will be available?
Yeah, so this equipment is already under trial, and most probably mid of October or November we are going to launch it. We are going to place it, and it is going across almost 6 countries, which already we got a lot of orders for the equipments. But then we will go step by step, because we ensure that there is 0% error in whatever we do in terms of trust. And when it comes to the services, trust is more important, because this is where they are going to have the comfortability. So every step, every statutory things, everything will be in place, so that we could launch it very safely for the public. So most probably in October, mid of October, we are going to launch it.
In Hyderabad, which places can we expect?
Hyderabad, there are a couple of places which we have already been selected, and once the approvals and the finalization is happened, then we could declare the places.